Things off. Well, my name's Jonas McKinley. I'm with UC Health, and I'm a member of the Fort Collins Chamber of Commerce. I'm on the Health Sector Partnership on their leadership team, and I'm very excited to be running you through this program today. So we have a lot to get through. I'll kind of get things going. So this is the second year that the Northern Colorado Health Sector Partnership has kind of taken the leadership on this event. We want to recognize and thank the Fort Collins Chamber of Commerce for kicking this event off many years ago and making it a big success. We're very excited to take this over from them and, again, appreciate their leadership in helping us make this happen. So the agenda today was driven by conversations that we have both at the Health Sector Partnership and just out in the community. So a lot of people in this room are clearly in healthcare. We get questions brought to us. We have a lot of hot topics going on in Northern Colorado. So we're going to try to address a lot of them today. We're certainly not going to get through everything, but we tried to pick things that would be beneficial both to the healthcare community and also to the business community at large. So when I was up here last year, we mentioned that the goal of this event is really for healthcare to report out to the business community and to the community at large, not necessarily healthcare talking to healthcare. We do that a lot in our daily lives. So hopefully our agenda today got a lot of business people in the room, and we're really excited about the topics that we have. So on your table, we're going to have a lot of QR codes up today. So if you want to pull out your phone, today's a good day to have your phone out just for the QR codes. Try not to check email. But if you get it off the screen now, you can do that. That'll have a program and our agenda. It's also on your table. So if you miss this and we go to the next slide, which we will here in a second, feel free to do that at any point today, and you can kind of pull up the agenda and see what we're going to be covering. But the three main topics and the way we've kind of structured this is we're going to explore cutting-edge healthcare innovations. That's going to be the first section of our program today. Second, we're going to address ageism in healthcare. We think that's a really big topic, one that's not talked about a lot, and we think will be more, certainly with an aging population in our country. And then we're also going to talk about behavioral health in healthcare. That is a hot topic and one that we've been discussing the last few years at this event and will continue to as long as it remains a high priority, which it should be for a long time. So again, scan that QR code, bring the agenda up if you want it. Also want to encourage you to visit our sponsor booth. So this year, for the first time, we have a bingo card for you to fill out. So you should have gotten one of these when you registered. There is a prize. It's a $50 gift card. So if you stop by all the sponsor booths, which doesn't take much time, get this filled out and turn it in at the end of the day, we will have a $50 gift card drawing at the end, and we'll get that gift card to you. So turn it in before you leave. Again, I don't believe you have to be present to win, but we'll get it to you afterwards. So, and make sure your name is on here. I've been at events like this where people turn them in without filling it out. So definitely get credit for that. So I've mentioned the Health Sector Partnership a couple of times. We're not going to do the full spiel this year. Last year I kind of went in depth about the Health Sector Partnership, and I've done it at events in prior years. But big things you need to know is it's an industry-driven, industry-led organization. So it's all volunteers, it's not a nonprofit, and we come together to solve healthcare issues in Northern Colorado specifically. So it's industry coming to the table and saying, here are the problems and we need help. And then we can take those problems out to community partners, to the public sector, and say, education, we need your help. Cities, counties, we need your help. Here's how you can assist us. So we just celebrated our 10-year anniversary, and rather than going through the full spiel, I thought I would play our 10th anniversary video. We just had a celebration a couple months ago. For those of you that were at our quarterly meeting, you've already seen this, but it'll be fun to see it again. It's just a kind of an account of the accomplishments we've had over the past 10 years. So please take a look. All right. So we're going to have, yes, right? So I've been involved from the start. How many of you were at that original meeting? Is there, yeah, show of hands. This is your chance to work off that Halloween candy. We're going to have a number of opportunities to raise hands. So, all right, there's a few of you. So thanks to those of you that were there from the start, and a lot of you have joined since and been super involved in our action areas. So we do still have 3 action areas, very similar to where we started, and I thought I'd just briefly mention them. So workforce, anybody in this room, no matter what industry you're in, workforce is probably a challenge, and in healthcare, we're certainly no exception. So workforce is one of our biggest priorities, behavioral health as well, and outreach and awareness. So those are our 3 groups. If you want to join, and we'll have this up later as well, but we have a QR code here. Go ahead and scan that. If you're not on the mailing list, at least get involved and attend our quarterly meetings. If you're wanting to give back a little more than that, we have opportunities to join all those committees. We're always looking for leaders to step up and into roles on those committees, and it's a great way to actually get stuff done. So I've been involved in a lot of different groups that meet and talk and have lots of great conversation, but never actually do anything. And the reason I'm still a member 10 years later is get stuff done. And it's exciting at the end of the year to look back, see our annual report, and realize we accomplished things across a number of different areas, across workforce, across behavioral health, that were meaningful to our community. So big believer in it, and again, would love to have you join and be involved in that. I also want to plug, we have another event. So again, we planned this event. We're currently in the planning stages of our next event. We held this for the first time earlier this year. It was a huge success. We're going to be having it again next year. We're going to be looking for sponsors. So we would definitely love to have you sponsor that event. And I also want to say, if you are a nurse or you have nurses on your staff that you want to support, go ahead and put this in your calendar, do a save the date, and you'll want your nurses there. It's a chance for them to kind of recharge, have a day fully focused on them, their well-being. Again, been a very difficult few years for nurses, particularly through COVID and coming out of that. So we want to support them. That was a big priority of our sector partnership, was looking at how do we support them. And this event kind of came out of that want and that need. So save the date for that. We're really excited about it. And if you'd like to sponsor, you can reach out to anybody on the Health Sector Partnership, myself, Carol Salter, who's here and kind of organizing it in the back. So make sure to say hi to Carol at some point today if you want to get involved with that. One of the topics we had last year, which we didn't have time for today, was a legislative update. And we're 4 or 5 months out from the next session. It starts January 10th. And we're months removed from the last session. We did have, in our Health Sector Partnership quarterly meeting earlier this year, we had a full legislative review of all the bills that passed, ones that didn't, things that we have to monitor. So we're not going to go through everything, but we did talk to NCLA, the Northern Colorado Legislative Alliance, and said, what are some things we can expect for this session? So I have just some thoughts on what might be coming, and I thought I'd at least run that by you so you're aware. And then as we get closer, NCLA is obviously tracking these. The Health Sector Partnership will be tracking these bills as well, and we'll report out, to our membership at that point. So, again, another reason to get involved in the sector partnership. So this next session, we anticipate seeing a lot of the same issues that were worked on last year. So there's a lot of things that didn't result in a bill being passed last year that we expect to pop up again. So the interim opioid committee met all summer and has 6 bills drafted for introduction around substance use disorder. So lots of work is being done in that opioid area. We expect to see some of those bills come forward and likely some pass as well. We anticipate something around provider assaults from the Colorado Hospital Association. That's been an issue in our hospitals. So various provider compact legislation, specifically around social workers, continued healthcare workforce bills, and an increase to Medicaid reimbursement rates across all providers, which I think will be welcome news for a lot of you in this room. The Behavioral Health Administration continues to work on the Regional Access Accountable Entities maps, so the RAE maps. That'll continue to happen. Hospitals will continue to be scrutinized for community benefit dollars, and we may see more on that. And let's see. That's kind of the big ones. So I think those were the big topics we expect. Again, there'll be surprises. There'll be more stuff to come. But Just wanted to point out a few of those. So next up, this is a big event. A lot of you sitting out here sponsored this event. We want to make sure you get recognized. We could not have done this without our sponsors. So we're going to go through these as quick as we can. If you would, just hold your applause. We'll applaud at the end and thank all of them at once. So our platinum sponsor this year was the Fort Collins Area Chamber of Commerce. Gold sponsors were Summit Stone Health Partners and UC Health. Our silver sponsors were Banner Health, Columbine Health Systems, Kaiser Permanente, and North Range Behavioral Health. Our bronze sponsors were 50 Plus Media Solutions, Centennial Area Health Education Center, City of Fort Collins, ENT Credit Union, Front Range Community College, iHeart Media, Northern Colorado Long-Term Acute Hospital and Northern Colorado Rehabilitation Hospital, Orthopedic and Spine Center of the Rockies, Pathways, Senior Voice, UC Health Plan Administrators. And our booth sponsors were Allergy and Asthma Center of the Rockies, Bloom Healthcare, Canyon Home Care and Hospice, Dementia Together, Emergency Physicians of the Rockies, Family Care Center, and Grand Canyon University. Please join me in thanking our sponsors of this year's event. And since the Health Sector Partnership is putting this event on, we wanted to go ahead and thank our Health Sector Partnership sponsors. So these are people that gave money towards our efforts, not towards a specific event or a specific goal, but just to help further the Health Sector Partnership's goals. So we have City of Fort Collins, Larimer County, Fort Collins Area Chamber of Commerce, Kaiser Permanente, UC Health, City of Greeley, North Range Behavioral Health, Emergency Physicians of the Rockies, and Pathways. Please thank them as well. So I'd like to highlight one of our gold sponsors. We're going to highlight Summit Stone Health Partners, and we have a video for you. I just want to say we're thankful to Summit Stone Health Partners and all that they do for our community. They're extremely involved in the Health Sector Partnership on our committees, and specifically all the support they're going to be providing to our community through the Longview Acute Care Behavioral Health Campus opening up later this year. Very excited to have that open. Let's give them a round of applause. All right, you guys ready to talk about some cutting-edge healthcare stuff? Yeah? I'm very excited about this topic. I was very excited last year. I think this will be something we do every year, and it's a chance to highlight not just what's cutting edge in healthcare, because there's all kinds of stuff happening, but what's happening specifically in Northern Colorado. And everything you're going to hear today, all the companies you're going to hear from are all local. They all have a presence here, and all these programs are being implemented here locally. So I think that's very exciting.